Welcome to Educator Podcast. My name is Swapnil. I'm intensivist from Sydney, and today we have a very special guest from Harvard Medical School, Dr. Subha Ramani. Dr. Ramani is an assistant professor of medicine at Harvard Medical School and a faculty member in the Department of Medicine at Brigham and Women's Hospital. After graduating from Stanley Medical College at the University of Madras in India, she completed internal medicine residencies in India as well as in the US. She went on to do a general medicine fellowship at Boston University School of Medicine and completed an MPH, that is Masters in Public Health, at the Boston University School of Public Health. Subha went on to pursue an extensive training in medical education, including the Stanford Faculty Development Program and Harvard Massey Program for Educators. She has also completed Masters in Medical Education at the University of Dundee in Scotland. She is a seasoned educator and has taught medical students, residents, and organized a faculty development for educators for over 15 years. Subha has a few key educational leadership roles. As the Director of Evaluation for the Internal Medicine Residency Program, she leads the residency assessment and feedback initiatives. As the Director of the Scholars in Medical Education Pathway, she leads a medical education concentration pathway for internal medicine residents interested in careers in medical education. She is also the course director for the Brigham and Women's Department of Medicine annual medical education retreat. Subha serves as the Director of Research and Scholarship for the Harvard Massey Institute. In this role, she collaborates with and mentors other scholars and faculty as they engage in educational scholarship. Her scholarship includes research and non-research papers in medical education published in core medical education journals, book chapters, and new education curricula. Last but not the least, she is completing her PhD in health professions education at Maastricht University in Netherlands. Her research aims to explore the institutional feedback culture, improve the giving and receiving of feedback within the Department of Medicine, and enhance the learning culture to support feedback aimed at professional growth. It's my pleasure and privilege to welcome Dr. Ramani at Educators Podcast. Welcome, Dr. Ramani.
Thank you, Swapna, for inviting me.
How's the weather in the Boston?
Well, as of today, I think we're going to have a heat wave. Until yesterday, it was very pleasant.
Okay, it's completely opposite to Sydney, looks like.
Yes, that's true. I mean, we are on the opposite side of the world as far as weather is concerned, as far as the equator is concerned. So our summer is just beginning.
Okay. So let's get into today's podcast. Now,
Sure.
I noticed that you have published extensively on the topic, which I found very challenging as I progressed through my medical career, that is feedback. And I'm pretty sure that you are going to help us today to understand this complex concept, and possibly you will equip us with some of the tools for the future. Now,
As you mentioned rightly, it's a very complex topic. I'll do my best, but there are going to be a lot of unanswered questions at the end.
So now there is an extensive literature out there on how to deliver a feedback. And almost every educational workshop or conference now talks about giving a feedback. Yet we as educators struggle to get it right. What's your thoughts on that?
Swapnil, I'm very happy you asked me that question, because that was the very question that started me on my whole research projects recently, which is part of my doctorate, as you're aware. So I think really that we are looking at feedback from the wrong perspective. We have been traditionally looking at feedback from the educator's perspective. How do I give feedback? How do I deliver right content? What skills should I learn? during any faculty development seminar. And I think for quite a long time, we've been ignoring, like, what is the purpose of this feedback? Like, who is receiving it? Is it being received at all? And in fact, there's so much research that says that even though educators feel they are giving feedback and giving high quality feedback, when they interviewed or surveyed learners, they almost always said, oh, we don't get enough feedback and the quality of feedback is no good. And from the 1990s, I think we are starting to look at feedback from the right perspective, which is from the perspective of the learner. And it's from Australia, David Bowd and Liz Malloy's work that started redefining feedback as it needs to be effective as far as we think of the impact on the learner, not really the skills of the provider. And that was I think a really new paradigm in the definition of feedback. It is the learner accepting it? Is the learner incorporating it? Is the learner's behavior changing? Because what is the point of all the skills and feedback if there's no behavior change at the end of it? And then there have been some amazing work that's come out of Canada, from Dalhousie, from University of Western Ontario, from University of British Columbia. Some amazing work that's come out, which then started focusing on this whole cultural aspect or socio-cultural aspects of feedback. So what is it that goes on between the institution and the learner, or the teachers and the learners, in order that feedback is effective? So, and that's the whole sociocultural perspective on feedback. And out of that was born this concept of feedback culture, the learning culture, and comparison of other cultures to medical education culture. And that's Chris Watling and his colleagues. And then we moved to the eastern coast of Canada, from Dalhousie, my own former mentor, Karen Mann, and her entire group, Joan Sargent, who's the lead on this initiative. They basically talk about what are the emotions that occur during a feedback conversation, and how there is a conflict between learners' self-assessment and then their willingness to accept feedback that conflicts with their self-assessment, basically. And then new models have come up which have deviated far away from the feedback sandwich and other how do teachers give models, to a reflective approach, a coaching approach, a relationship-centered approach. And the two, actually, I'll quote three of them that I would encourage everybody to read. Is the R2C2 model that comes out of Dalhousie. Joan Sargent and her colleagues have written a framework. They've tested a framework. And in fact, they are disseminating. A lot of people are using this framework. And that is R for relationship. The second R is exploring reaction. The first C is understanding of the content. And the last C is a coaching approach for growth. Now, there is another educational alliance that comes out of University of British Columbia that basically says this rapport and the relationship needs to be at the heart of effective feedback conversation. And the latest, you can almost say, metaphor that has been used to describe a feedback exchange is the tango. And this comes out of University of Maine in Portland, Maine Medical Center in Portland, by Bingyu and colleagues. So I think we have moved further and further away from this whole I'm an educator and how do I develop my skills in giving feedback, to thinking about, okay, when I give feedback, what is it that I need to do in order that the learners will receive it, accept it, and actually make plans for improvement. So that is a long answer to your short question, but I hope that was helpful.
Now, that's really a comprehensive answer, and thanks for that. One of the key pieces that you contributed to the literature is It's Not Just the Culture, where you explored the impact of institutional culture on feedback. Can you tell us more about your research findings?
Certainly, be very happy to do that. So, my work started, that is where my real robust work on feedback started, which is an open ended exploration of what do residents actually think about the quality of feedback. What do they think should be strategies in the feedback dialogue that can actually make it effective? And I went in really not to test my assumptions or test my predetermined hypothesis. I just went in to get from them what their perspectives were. And this was born out of a series of surveys, end of the year surveys, which the Graduate Medical Education Office does, and which almost always said feedback quality was very poor. And so I wasn't expecting this at all, but almost every theme that came out mentioned culture in some form or the other. Of course, in that study alone, I didn't probe what they meant as a culture. But an example is that there is a need to establish a culture of longitudinal growth. And then bidirectional feedback, that is feedback from residents to attending physicians, is not in our culture. So I was really curious because every theme, the area that the residents focused on had something to do with culture. And that led me to read the business literature about organizational culture. And I thought how curious the Shine's 3 levels of organizational culture fits in beautifully with the feedback culture at our institution. And the levels of culture are really, the first level is the deepest deepest and assumed culture and values, which is, this is the way we do things here. And every new person who enters this organization will be instructed in how to behave in this culture. It's not written, it's not said, but it's just assumed. The second level refers to really the written values and expectations. And if I look at feedback, it was all about, we believe in feedback and we need to be exchanging feedback regularly. And there is a frequency to which the expectations were written. The first level was always, the deepest level was always, we are an organization that's very kind, humane to each other, and gentle and compassionate. Those were really one of the leading qualities of our organization. And then finally, what happens when that level 1 and level 2 culture mixes up, the behaviors end up being, we need to be kind, but we need to give feedback. What is the equation? We'll just be kind and give good feedback. And the residents so astutely brought this point up. It was incredible and it was illuminating to hear from their own voices this concept. And then, of course, I knew nothing about this theory called politeness theory, which comes out of sociolinguistic theory. And I said, that led me to read more about the theory as I was guided by my advisors, who are much more knowledgeable about psychosocial theories and how they apply to education. So the politeness theory basically talks about 2 things that all humans need when they're interacting with another human being. One is called the positive face, which is, I interact, and in any conversation, I need to look good to the other person. Self-efficacy, self-esteem. The other side is, in any interaction, I want to be unhindered, meaning, and I took that as autonomy. So I want freedom to carry out my job. And I applied this to feedback conversations between consultants, attending physicians, and junior doctors, residents. And certainly the faculty were most concerned about residents' self-efficacy, and as were the residents. But faculty seemed to be even more concerned. No, I shan't allow the resident to go away thinking they're doing less than sterling job. Therefore, I will only use kind words. And on the other side, Chris Watling's work basically said, we can only give constructive, specific feedback which would be acceptable and credible if performance is observed directly. Now it comes to the second part, autonomy. As residents mature, they don't want to be observed. They don't want anyone in the room. They want to carry out their work independently. And the faculty are very aware of that. So, we have this catch-22 situation where we attend to their self-esteem, we attend to their autonomy, we don't observe, we don't have enough information or enough data to provide which can be credible. And if it's not credible, it's not accepted. And if it's not accepted, it's not incorporated into performance. And then how will any deficiency in performance improve? So see this vicious cycle going round and round, which is really what came out of my first two studies. And it was fascinating because it was not at all what I was expecting. And it hasn't been written in the past about feedback, but I was diving deeper and deeper into incredible territory. And I'm so happy that people are reading it and appreciating this work and then applying it in the light of amazing work done by other researchers before me.
Wow, that's such a great piece of work. And I like the one sentence that you said at the very beginning, that you went into this research without any assumptions. And that's such a hard thing to do as a researcher, to go without an assumptions. And I think that's incredible research.
That was extremely important, and also needs a qualitative frame of mind to do that. And there's an academic medicine last page that we wrote, or it's published, it's at least early online, or just purely on reflexivity in qualitative research. So having your assumptions, having your biases, of course we all have them, but however, how do we use or abuse it in the context of a study? Are we open-minded? Are we asking the right questions? Are we allowing for a variety of opinions, even if it doesn't support our own? So I think anyone who wishes to do research, and especially qualitatively, they should read about reflexivity and practice reflexivity.
Thank you. Thank you very much. I think that's really important advice for budding educators in terms of the research. Now, one of the key statements in your paper was a polite culture promotes a positive learning environment, but can be a barrier to honest feedback. How do you think we can strike that balance?
Now, that is an excellent question. And I'm going to quote my own residents who basically said, we don't want to destroy this polite culture because it feels like a family. The whole residency program feels like a family, which means it makes a stressful job easier to do. And it also makes it easier to work. It makes it easier to learn. They certainly don't want to destroy it. But one of them said, isn't it in line with the polite culture that we also have an obligation to help others grow professionally? And I couldn't say it better than that statement. Therefore, harnessing that polite culture and saying, yes, if you truly care about your residents, your learners, then we need to also ensure that they continue to grow. Even if they are outstanding, even if they are of the highest caliber, there are always going to be some domains that we need to improve on, work on. And and we'll come, I'm sure you're going to bring this question. I think one of the things might be to encourage or enhance self-awareness amongst our teachers and learners, facilitate self-reflection on their own performance, ask for feedback in line with their own learning goals, because if we enhance those three things, then feedback will become more acceptable, and I mean specifically constructive feedback. So that would be where the polite culture, I think, can be harnessed, but it needs to come from a pervasive change in the culture.
That's so true. But one of the things that I noticed with a lot of educators, and especially myself, that we feel very comfortable to give feedback to our juniors, but we are not that good in giving feedback to our seniors. What are the techniques that you will recommend to our budding educators in order to do it effectively?
That is an excellent question, and I can't say that we have all the answers to the question. Again, I will look to my residents to answer this question. So I call it the paradox, the politeness paradox. And on the one hand, the environment, the work environment and learning environment feels like a family-like atmosphere. But on the other hand, even this family-like atmosphere still prevents juniors from giving feedback to seniors. So I interviewed both sides, multiple groups of residents and several groups of faculty, asking them this very question. So faculty said, oh, we'd love feedback from the residents because it will make us improve as teachers. At the same time, they said we hardly ever get feedback from residents, except if we do something, if our rounds are too long, or if there's a conflict of some sort, or, what topics can you teach? So I asked them the question, like, okay, how often do you ask for feedback from your learners? And they acknowledged that they always want to, but they end up not asking. Okay, so feedback seeking from the higher levels would be important. But the other thing about feedback seeking is it's not only about, oh, can you give me some feedback? It needs to be a lot more explicit. It's big. Here are my goals as a teacher. And as you know, the Harvard Macy program, we do the micro teaching, don't we?
Yes.
And and that's exactly how this whole conversation should occur, I feel, which is the teachers establish some educational goals. They express those goals to their learners. And then they come back and say, self-assess on their own, self-assess on whether they accomplished the goals, whether certain behaviors were effective, what behaviors were not effective, and what they might do differently the next time. Followed by, if this happens, then it would be easier for the learners to give us feedback. So they have a couple of specific goals to target. They have observed the teachers do something. They have heard the teacher's self-assessment, and then they might add and subtract and then say, oh, here's something you can do next time. I think this is the loop that's important. So that's the faculty side. And I went to the residents and asked them, do you give feedback to faculty? And there was a lot of, I think, turbulence, if you like, in their own minds. On the one hand, they say, yeah, it's important to give faculty feedback so that they continue to improve and grow. But despite the politeness around that's all pervasive, it's still hierarchical. See, I call that the paradox. It's still a very hierarchical culture. And we don't want to give feedback upwards just in case we offend somebody and then we don't get good letters or good evaluations. or something happens that can damage their future career plans. So, but then they acknowledge it was important. I asked them this question, which is, don't you think faculty are also growing? They are at a different developmental scale, but then aren't they also growing? And do you not have an obligation to help them grow? When I posed the question, they all looked at me and said, yeah, I guess that's true, but but it's still too hierarchical. So and some of them flatly said, nope, I won't give feedback to my faculty. I will give confidential feedback, or rather anonymous feedback, to someone else, to the chief resident, to the program director. So I could not sway them further. But many came down and gave me some suggestions. They said, if the faculty manner, how they engage with the learners would matter a lot. So learners need to be convinced that the faculty actually mean it when they say, I'm interested in improving and I'm interested in your feedback. Not just, oh, can you give me, how did I do? So that's one. The faculty manner and the interactions with learners would be important. The second thing is, they said we won't initiate the conversation unless faculty actually seek feedback. So feedback seeking would be quite important from the faculty. And the third thing they said was feedback, not only feedback seeking, but what is it they're seeking feedback on? That's the third thing. And the last thing was, if the faculty are willing to acknowledge their own errors and their own limitations, that would help us give feedback to them. So those were the four essential principles, I'd say, or prerequisites to allow learners to give feedback to faculty and believe that it would be accepted with grace.
That's great. So it kind of brings back to that concept of psychological safety within the organization, where people feel safe to interact with each other and share their views about each other.
Very true. And I think it goes beyond the individual faculty, individual learner level. It goes right to the heart of the institution. So the institution or organization needs to set some overt expectations, saying that we expect feedback from upper to lower levels and lower to upper levels with, a growth-minded culture, learning and work culture. Okay, everybody will grow in this arrangement. The second overt statement should be, we expect everybody to have strengths, and they will also have areas that need to improve. And this will occur at all levels, all learner levels, all faculty levels. Therefore, constructive feedback should be a mandate from any level to any level. And then I think people need to be taught how to phrase constructive feedback, how to go further and say, okay, that's the constructive feedback, but here's how we can improve, what are the action plans? So I think constructive feedback should always be anchored in action plans. And that way everybody goes away saying, oh, here's something I learned today. The last thing I think you might be referring to is what I call the growth mindset. And this comes out of psychological literature, the Carol Dweck's work, and who is fabulous work, which talks about mindsets, two main mindsets. One is a fixed mindset, which essentially makes people think that, oh, we are a product, our performance is a product of our skills and talents and intrinsic attributes, and it can't change. Okay? And then the other is a growth mindset, which basically says you grow throughout your personal and professional life. And part of it is making mistakes, failing. And failure is not seen as a negative thing, but it's seen on the growth curve, basically. I feel like much of professional education, or should I just say medical education, promotes this fixed mindset to a certain extent. I mean, and I'm not going to stereotype all mindsets, but in many instances, it's about our assessment, how we perform on our assessment, how we graduate from one level to the other. And that fear of not progressing or not succeeding leads to somewhat of a fixed mindset. And therefore, any description of failure or weaknesses or deficiencies causes intense perturbation of the soul. Whereas on the other hand, if we say, okay, so what is it that you're having trouble with? This is normal, and let's work on it. And you go to the next level. That is a growth mindset. And that growth mindset needs to be modeled by senior people, leaders, institutional leaders, senior faculty, junior faculty. And if we model this, part of the hidden curriculum, if you like, if we model this, I think we can inculcate a lot of it amongst our young learners as well.
That's such an important message out there, that change from fixed mindset to growth mindset. Thanks for sharing that. Now, I like another one more thing that you mentioned about changing the pendulum from recipes to relationships in another your high impact article. Yet, we as educators look for some framework or recipe to give feedback. Do you think that is the right approach? And if not, what's the alternative strategies?
I think it's okay to look for a framework, because I would say that not all educators are going to go deep into the science of education and proceed to be scholarly about the topic. They just want to do a good job, which is very important. They want to do not just a good job, I would say an effective job of giving feedback. So people who are researching can establish some basic frameworks. Like I told you that two frameworks that I've been using, and one is the R2C2 and the other is Educational Alliance. And I wouldn't say they are recipes, they are basically steps, and they allow for latitude and flexibility in the language used, or even I would say in the order of which things are done. Okay? So a framework is good to frame a conversation for, especially for novice educators. But then there is latitude in how you react or converse with one learner versus another. It's like any human interaction. We don't use exactly the same words with every interaction, right? And the same should be true for the learner sitting in front of you. The learner is a personality, you're a personality, and then your combination of personalities is going to be different. It's going to be different with one learner versus the other. So frameworks are okay. I wouldn't call frameworks recipes. And recipes are when it's like 1 spoonful of sugar and 1 spoonful of table salt and half a teaspoon of this and half a teaspoon of that. So trying to, bake a cake, you have to follow each step exactly as it's written. That is a recipe. And I don't think recipes would work in human interactions, but frameworks are okay. It's a reminder to say, have I established a relationship? Do I have rapport with this learner? How you do it could be individualized. There are examples in the R2C2, there are sample questions and comments that you can use in each step, and that's available on the Meded portal. And if people look up R2C2 on Meded portal, they'll find this educator's guide. But then it allows for freedom of thought and freedom of action and freedom of language. So frameworks are okay. I'm just arguing that recipes are not. And again, that's my opinion.
No, I think that's very important. I like the way that you differentiated the framework from the recipe, and I kind of like that way. Now, one of the tool that you talked about at Harvard Macy was Johari's Window. Can you tell us more about it and how we should use it?
Sure. So, I think one of the essential components of a feedback conversation is self awareness and self reflection. And in fact, much of the time, behavior change occurs from within after incorporating data from self assessment and other people's assessment, if that makes sense. Okay? That's actually been referred to as facilitated self-reflection and informed self-assessment, where a learner is not sitting in a room by themselves and reflecting. Actually, reflection on their performance is facilitated. Same way, self-assessment is not about what I think I did, but more of what I think I did, what he thought I did, what she thought I did, taking data from multiple, reconciling and saying, okay, so this is the accurate assessment of my performance. So, but then in order to do both effectively, you need to have a mindset of self awareness. What is it? What are my strengths? What are my weaknesses? Am I willing to discover those, especially the weaknesses? And that led me to reading about the Johari Window, which really was a psychological framework developed by two psychologists. And the Joe stands for comes out of Joseph Luft, and the Harry comes from Harrington or Harry Ingham, two psychologists. And in the 1950s, they developed this matrix in really interacting, psychologist patient interactions. And it was to enable awareness and understanding of own behaviors during these interactions. So they call it a window or a box or a frame. You can call it anything. And then there are 4 quadrants or 4 rooms that occur when you look at awareness of behavior by self and awareness of behaviors by others. So 4 quadrants come up. The top left is behaviors that are known to self and known to others. So it's quite open, and it's called the open quadrant. And as far as feedback goes, discussing known behaviors are good as a measure of validating someone's performance and encouraging them to do better. You can also put in self-determination theory here, and one of the elements of the 3 elements, competence, comes in here. We want to be competent, and that motivates us. So the top right is basically called the blind window or the blind quadrant. These are behaviors that we ourselves are not aware of, but it's clearly obvious to others. And if you look at it in a micro teaching perspective, there are some behaviors we are completely unaware of, but then we watched our own videotape of teaching, and suddenly it's like, oh my God, I had no idea that I was doing that, or I was not doing that. So that's called the blind, and we need to be self-aware to the point where we are going to have blind spots, and we need to listen to others in order to improve. The bottom left is what's called the hidden, which is we know certain things about our context and in which the performance occurred, and about our behaviors and our fears, our limitations, our insecurities, but then others don't know this. And that's hidden. We hide it from others. And in the context of feedback, I state that we would be willing to disclose these insecurities and fears and limitations to somebody whom we trust. Therefore, relationships are very important. Again, it comes back to relationships. And the last quadrant, the bottom right, is unknown, and it's for future discovery. So unknown, we don't know what our potential is as yet at any given time, because life constantly evolves. And then we also don't know, certain limitations may come up and we discover it in the future. And so what I said was, in the context of feedback, we need to be willing to continue to discover things about ourselves. And also, multi-source feedback could be quite important, because each source might actually illuminate us on a different dimension of our performance. So this is how I took the Johari window, which is a psychological interaction, and it's all about self-awareness, which I felt was very, very integral to the whole process of feedback, and particularly its impact, and applied it to feedback.
Great. One of the key statement in your answer was continue to discover. Now, in your research, you have explored the impact of culture on feedback. Now, what's the next?
Good question. So the next is, as you're aware, and I know you're aware of the published articles so far, and it's all been about opinions, correct? It's like, what are your perspectives on the quality of feedback? What are your perspectives on the culture of feedback? How do you define the culture? And how can we enhance the culture and raise the impact of feedback? So this was focus group discussions with residents, focus group discussions with faculty, interviews, one-on-one interviews with faculty. But now the time is to find out whether what they think and what they do are consistent. So the next, what I've been working on right now is the observation of faculty resident feedback conversation, just looking at what do they do, what do they say, what are the verbals, what are the nonverbal behaviors, and then taking it back to them and say, tell me what you thought about that conversation that you just had. Is it going to create behavior change? So that's what my next steps are. And once I do that, I would really like to do some or design some training in feedback, which focus not on necessarily a framework, because there are wonderful frameworks there already, but driving this point forward about self-awareness, self-reflection, self-assessment, self-determination, self-regulation. Like, I want to take a deeper dive into the concept of self, and how all these self characteristics matter so much in seeking, accepting feedback, and then behavior change. So those two things would be my future.
That sounds really very fascinating, and I'm looking forward to this research. And I'm pretty sure this will help all of us to take a deeper dive into this concept. Now, last but most important, what's your advice to budding educators?
I rarely give advice, but I can just tell you the mistakes I made along the way, so that others can learn from them. I think, and you might call it advice, but I'll call it learning from my mistakes. So budding educators tend to be very hard on themselves. They want to get everything perfect the first time they do it. Teaching in large groups, teaching in small groups, giving feedback, anything, any aspect of teaching. And I think budding educators need to be also, I'll say, put the Johari window onto the budding educators. It would be great to acknowledge what you did well, give yourself a pat on the back. It would be equally important to understand that there are areas of your performance that you can't see, and maybe have a colleague sit in on your teaching and then debrief the session with you. There would be fears and limitations and insecurities while we all teach, and this doesn't apply solely to budding educators. I think this applies to seasoned educators as well, that adrenaline rush, the fear that comes before a major teaching session. And perhaps, again, go to a trusted colleague and express these and thrash it out with them. Express it even to a trusted learner. Why not? Say, I'm having these fears. Tell me how I did. I think that would make for a great relationship between teachers and learners. And finally, just say that you are going to grow. New behaviors are going to emerge. Old behaviors may continue or may be expunged. So it is it's developmental scale for trajectory for teachers as well. They are growing, they are on a journey. And I think it would be wonderful for them to just stop and smell the roses and enjoy the journey and enjoy the privilege of somehow changing young minds and being a waymarker in their own journey.
That's such a great advice. Thanks, Dr. Ramani. It was pleasure talking to you, and thanks again for your valuable time.
Thank you very much, Swapnil, for doing this wonderful series. And again, it was a pleasure for me to participate as well, and an honor. Thank you.
Thank you. Goodbye.
Goodbye.